Today on Wisconsin Doctors, diabetes prevention, management, treatment, and symptoms. We're on location at Bluff Medical Center to learn more, and I'm joined by a fantastic group of experts on the topic, including Penny Wachowiak, registered nurse, Margaret Hewitt, registered dietitian nutritionist, and Kathy Cass, certified ophthalmic assistant. I'm Justin Riley, and this is Wisconsin Doctors, only on Wisconsin's 57. Welcome back to Wisconsin Doctors. We are here on location at Bluff Medical Center, and since November is American Diabetes Month, we'll be focusing today's discussion on diabetes. And I'd like to start by having each of you briefly introduce yourselves and share with us your role in providing care and education for individuals with diabetes. So Penny, we'll start with you.
Hi, I'm Penny Wachowiak, and I'm the diabetic educator here at Bluff Medical Center. And when patients are newly diagnosed with diabetes, either type 1, type 2, or gestational, then they come to see me, or if they've had diabetes for some time and it's getting out of control, they come to see me and we do a comprehensive visit, either in a individual, one-on-one, or in a group setting. Okay, and what we talk about is anything from learning how to test your blood sugar and what those ranges should be, to foods you can eat. However, I send them to dietary for a better handle on that.
Sure. And we'll learn later on in the show that there's a lot of there's lifestyle changes that people can and should do to manage their diabetes. So obviously, learning what those things are and how to manage those different aspects is important.
Yes.
Important thing to teach. So, Margaret Hewitt.
Yes, I'm a dietitian and certified diabetes educator. I've worked in diabetes specifically the last 4 years, but I've been a dietitian for about 8. I currently help with our hospital patients as well as outpatient visits with Penny. So we do individual appointments or group classes. And I often focus primarily on the nutrition and activity lifestyle changes to help manage blood sugars.
And it's interesting to note that that has such an impact. The lifestyle and the dietary aspect have such an impact on blood sugar, which is really kind of the whole issue with diabetes. So
yeah, it's, I think, great for people to learn. Mm-hmm. You know, we are used to our normal eating habits, mm-hmm. and to change with a diagnosis of diabetes can be hard, but our goal is to help try and make it easier for people.
Absolutely. Kathy Cass.
I am a certified ophthalmic assistant. I work with the UW doctors that come down to the clinic down. They come up from Madison. I've been an assistant for 13 years. Mm-hmm. We have 4 doctors that come down there that they're all capable of seeing patients with diabetes, ranging from newly diagnosed to ones that haven't had eye care ever.
Wow. Okay.
So when you come to see us, we'll do a dilated exam, so your eyes will be dilated. Probably lasts 2 to 4 hours generally. So.
Okay. And can you elaborate on what exactly you're looking for when you do a dilated eye exam?
The doctors are looking for any disease that's going on in the back of the eye, whether it be bleeding. Sure. Edema, things that are making your vision not good. They can detect that early before the patients even notice a lot of changes.
Really? Okay. Mm-hmm. And that can be, having edema in your eye can be a sign of, potentially be a sign of diabetes?
Yes, it can.
Mm-hmm. Wow. Okay, that's good to know. That's good to know. I'm going to jump back to you for a second here, Penny, because you mentioned gestational diabetes. I'm wondering if you can just give a brief overview for those who don't know, may not know what gestational diabetes is. What exactly is that?
Well, Margaret, gestational diabetes is basically with pregnant women only. Okay, so their blood sugars start rising in their second or third trimester, and that's when Margaret and I get together, help them try to control that, so it doesn't lead to complications to the baby being born.
Okay, because that can be a pretty serious issue then
Yes,
for
it can
the
be.
well-being of the child.
Yes.
Yeah.
And generally, after giving birth, the diabetes will go away for anywhere from, a short period of time to maybe 5-10 years before it shows up as type 2 diabetes.
Wow, okay. So hopefully the goal would be to help manage the gestational diabetes so it doesn't develop into type 2 diabetes or something like that
Right.
down the road. So interesting stuff. We're going to take a short break here. When we come back, we're going to start talking a little bit about how food and lifestyle changes can really impact managing your diabetes. Don't go away. There's more Wisconsin Doctors coming up right after the break here at Mile Bluff Medical Center. Welcome back to Wisconsin Doctors. We are on location at Mile Bluff Medical Center, and November is American Diabetes Month, and we're learning more about diabetes today. And Margaret Hewitt, I want to start with you as the registered dietitian nutritionist. I understand that there are foods that I can eat that may actually help to prevent me from getting diabetes. Can you tell me about some of those foods?
Yes, and instead of just thinking about certain foods, it's great to think about your whole day and your actual food plan.
Sure.
So thinking about trying to eat small portions throughout the day, 3 small meals and a couple snacks versus only eating once or twice in a day. Certain foods, though, that definitely help are those that are higher in fiber, more fresh foods, less processed items, less sugary beverages, for example. So things that are either, like fresh fruits or vegetables, can provide those high fiber needs. Also whole grains. High fiber, like superfoods for diabetes, also include things like legumes, nuts as well. Dark green leafy vegetables, citrus fruits, and berries as well are very high fiber. So just to give you an example of certain foods that could definitely help, but don't forget exercise can be just as important, if not more important, to help prevent diabetes. It's recommended to get at least 150 minutes of exercise per week to help prevent diabetes. That can help with reducing weight if we're in need of weight loss, in addition to just healthy eating.
I'm curious to know, what do you define as exercise? 150 minutes of exercise, what would be exercising? Because some people can say, well, I'll go for a stroll for 20 minutes. It doesn't really get my heart rate going, but what do you consider to be exercise?
Right, good question. You can see classifications of light activity, moderate, and vigorous. So when they mention 150 minutes a week is recommended, moderate would be like a brisk walk, where you're able to hold a conversation with someone, but you're not out of breath.
Sure. Okay.
So if you're able to sing while you're walking, that's considered light activity.
Okay, so you want to be able to talk but not sing is sort of what I'm saying here?
So I hope people are listening as you're walking by.
Okay, well, I try to sing all the time, so I don't know, maybe that's not the good thing for me. So Penny, I'm going to jump to you for a second. Can you talk about how a diabetes diagnosis is actually determined? I mean, when you do these tests, how do they determine that yes, you have diabetes or no, you don't?
Well, there's several ways. 2 or more blood sugars that are out of range. For pregnant women, they do what they call a glucose tolerance test. Feed them a lot of sugar and see how it comes down. Or if they're looking at your blood sugars and they may have been rising throughout the years, they may do what they call a hemoglobin A1C. And if that is greater than 5.7%, you're looking at creeping into the diabetic state.
Okay, so hemoglobin level at 5.7% is approaching diabetic levels.
Yeah, that's actually the pre-diabetic state.
Okay, pre-diabetic
Yep.
state. Okay. Is it reversible then? I mean, if you're in the pre-diabetic state before you actually have diabetes, is that reversible?
It's more maintainable through diet, activity, and if needed, sometimes they put them on medication depending on certain situations.
Right. And I think people are pretty familiar with the fact that lifestyle changes can help individuals to manage their diabetes diagnosis. But can you talk about what are some of the long-term complications of diabetes can be and why managing this disease is so important?
It is very important. There are several complications related to diabetes. One being neuropathy, which you've probably seen commercials on TV regarding hands and feet getting numb, tingling. That's number one that usually comes up. The other one is it can lead to heart disease, so we want to control that. And then thirdly, there is the nephropathy, kidney failure.
Wow, okay.
And then there's also the diabetic retinopathy, which is you lose your eyesight related to diabetes.
Yeah, all very serious things. And we're going to take a short break. When we come back, we're going to talk a little bit more about eye health and diabetes with Kathy. When we come back to Wisconsin Doctors here at Mile Bluff Medical Center. Stick around. Welcome back to Wisconsin Doctors. We're here at Mile Bluff Medical Center, and November is American Diabetes Month, so of course we're learning about diabetes. And Kathy Cass, I want to start with you for this segment because you work specifically with eye health. And can you share some information about what, I'm going to try this here, teleophthalmology is?
Yes. Teleophthalmology is bringing today's technologies to the small town area.
Okay.
So we use our smartphones, you can use cameras.
Really?
And when the patient comes down, we take a picture with them
Okay.
on our camera, and we can just shoot that right to Madison.
Oh,
And
nice.
then the ophthalmologist down there will look at it right then, and then, tell us if the patient has any eye disease.
Okay, so it's a special camera then that takes a picture of the eye then, and
Yep.
then you can just send it through a smartphone app of some kind down to Madison.
Yep. We don't have the smartphone app with us, but we have the camera that does it right.
Got it. Oh,
Yep.
the camera. Okay,
Yep, the
great.
camera will do that.
That's
but,
cool.
But there's also apps on your smartphones that the doctors have that they
Sure.
can, it just brings the patient
Sure.
that's here
Right.
and shoots it down to Madison.
Got it.
So they
got
don't
it.
have to be there.
So talk to us a little bit about how teleophthalmology works and what it's like for patients and what the specific benefits of this technology are for individuals with diabetes.
Well, the big benefit is that they don't have to travel to Madison. We
Right.
have a lot of elderly patients that it's hard for them to get to Madison,
Sure.
drive, or find a driver down there. We have it set up so that when the patient sees a primary doctor upstairs or wherever, they just do an order, and then that shoots the order off down on our computer.
Okay.
And the patient can come directly down, and we can do their pictures then.
Okay.
It generally takes about 2 minutes to take their picture. They
Okay.
don't have to be dilated.
Okay.
There's a rare occasion when we do have to dilate a patient's eyes, but not very often.
Wow, that's
And
good news.
then if the doctor sees any problems or anything suspicious, then they will call us back, and then we call the patient and get an appointment with them.
That's good. That's good. I think that's it's so interesting to me how there's so many different signs of that could be a sign of diabetes or being pre-diabetic. Even something as simple as the eye. Eye health.
Right.
So important to get your eyes checked.
Yep.
Penny, I'm going to jump over to you. When you work with patients who are first diagnosed with diabetes, what are some of the common feelings that individuals experience? How do they react?
There's an array of feelings from, they may have had a great aunt that had diabetes and had the worst outcomes, and so they're totally afraid. I've had patients afraid that they are going to go blind, or they are going to lose a limb, or those kinds of things. So they come in with all sorts of, being scared to,
Right.
if they've had a strong family history.
Right.
I expected this sooner or later,
Right.
so it's an array of different
Sure.
feelings.
Sure. And I'm curious to know, we talked about, with Margaret, we talked a little bit about blood sugar and the different types of blood sugar levels. I think we actually talked about that with you, Penny. But Margaret, I'm going to ask you this. Is there any truth to the idea that eating too many sweets will cause somebody to develop diabetes, or that if you have diabetes, you can never eat carbs again?
It's a really good question. A lot of people will sometimes say the term sugar diabetes. I have
Sure.
sugar diabetes. So
Okay.
we think that we've eaten too many sweets in our life so that we've caused our diabetes.
Right.
But that's not true. In general, it would be more if we tend to overeat portions every day, not just those sweets, where that could cause more weight gain. That is more likely to cause the insulin resistance, where your body is supposed to produce insulin to help control the blood sugar.
Right.
But diabetes is when we either don't make as much insulin as we used to, or our body has a hard time absorbing the insulin.
Okay.
So that's how weight loss really plays a role, because
Right.
if you can help your muscles have more of a chance to absorb the insulin, you can control your blood sugars that way.
So having that body fat tends to block the absorption of the insulin into your muscles then, which is really what you need. Wow.
Yeah,
Very
yeah,
interesting.
yeah.
Interesting.
So
we got to take a short break. When we come back, we're going to continue talking about diabetes here at Mile Bluff Medical Center. Don't go away. There's more Wisconsin Doctors coming up after the break. And welcome back to Wisconsin Doctors. We're here at Mile Bluff Medical Center learning about diabetes because November is American Diabetes Month. And Margaret, when we left off, before we went to commercial break, we talked. You had mentioned how it's really a myth that eating too many sweets throughout your lifetime can cause one to have diabetes. But I'm curious to know, after somebody has been diagnosed with diabetes, can nutrition and lifestyle choices cure their diabetes, or at least help them get off their medication?
good question. In terms of the importance of diet and exercise, they are two key roles to helping control blood sugar. But unfortunately, it doesn't necessarily mean that your body will be able to start producing more insulin again.
Right.
So once we've lost the ability to produce enough insulin to help control our blood sugars, sometimes medications are the best way to help control the blood sugar. So diet and exercise are very important to help keep your blood sugars from going too high or too low. But a lot of times, that's why we work so hard with people with their diet and exercise and medications and blood sugar monitoring, so that even if we can't necessarily cure diabetes, short of a pancreas transplant, we can still help control and manage their diabetes for the best quality of life.
So it's something that's very manageable as long as you're, sticking with the plan as far as what lifestyle changes you need to make, what you need to eat and not eat, and that kind of thing. And if you need medication, then sticking with that, you can live a pretty normal life, is from what I understand.
Yes, it's great to think about living with diabetes versus letting diabetes rule your life.
Control your life, yeah, absolutely.
Yeah.
Penny, I'm going to ask you this: when individuals with diabetes check their blood sugar, what numbers are they typically looking for? What's the normal safe range?
The normal safe range basically is we're looking between 80 and 130 before meals. Okay. And if you forgot to take it before the meal, you can wait 2 hours after you've taken your first bite and check it then, and it should be less than 180. That is giving you good control of your diabetes.
Okay. And it's important to try to at least have some space, either before your meal, take your blood sugar before your meal, or have some space after your meal, because your body is digesting all that food, and that'll make your blood sugar spike temporarily. Is that what I understand?
Yes, it will spike with every, the foods, the carbohydrates you eat.
Sure.
It will spike your blood sugar, but within 2 hours, it should be coming back down to, quote, a good range.
Okay, that's good to know. And Margaret, if there are foods that typically raise blood sugar more than others, does that mean they are bad for someone with diabetes?
No. Carbohydrates is the term you'll hear most often, which is just a big word for sugar or starch. And just to show some examples.
Ooh, props.
If we think of a healthy plate for diabetes eating, you'll see half a plate is non-starchy vegetables. And neither non-starchy vegetables like green beans, broccoli, cauliflower, green peppers, the list goes on. They have a small impact on your blood sugar. Protein foods as well, like eggs, cottage cheese, chicken, fish, have a low rise in blood sugar as well. But carbohydrates can come from starchy foods like breads, pasta, rice, cereals, potatoes, corn, even fruits, as well as milk and yogurt.
Okay.
It doesn't make them bad. We still get a lot of fiber, vitamins, and minerals and nutrients
Right.
from these foods that
Right.
you don't get from other categories.
Right.
So it's very important to still include carbohydrate foods just in the right portion size to help get a healthy diet without having too much rise in your blood sugar.
So keeping everything in moderation, it sounds like.
Yes, absolutely.
Penny, how can people in the Mauston area learn more about diabetes?
Well, there's a couple ways. Each month, the first Thursday of each month, we have what we call the Passport to Healthier Living with Diabetes, where we have a panel. Margaret and I are on that panel, along with a registered pharmacist who are there to answer your questions that you may have about diet, exercise, testing, or your doctor prescribed you a new medication and you want to learn a little bit more about it. So that's one way. And then finally, this November, as it is National Diabetes Month, we are having our annual event here at Mile Bluff Medical Center. And this year, our guest speaker is Dr. Lou, who is the ophthalmologist from Madison, who started our telehealth eye program here at Mile Bluff.
And I think that that's such a cool thing to have available here at Mile Bluff Medical Center in Mauston. And I think that people can know that they can get like top of the line, state of the art examinations right here in Mauston.
Yes.
I think that's really important to know, and we're glad that you're here, Kathy, to talk about
Thank
that
you.
with us today. And unfortunately, we're out of time. I wish we had more time to talk about this. But we're out of time today, so I want to thank all my guests. You did a great job today, and thank you for the information. That's all the time we have for Wisconsin Doctors. From all of us here at Mile Bluff Medical Center in Wisconsin's 57. We're inviting you to live longer, live better. We'll see you next time.